Hello and welcome back to another episode of You Want to Do What with Dan and Julie. Today we've got Maisie on, who is a dental student. Hi, Maisie.
Hiya, thanks for having me.
So Maisie, do you want to tell everyone a bit about what you do?
Yeah, absolutely. So I'm a second year dental student at Peninsula Dental School or the University of Plymouth. Yeah.
University of Plymouth, my
Yeah.
old campus.
Oh, no way.
Yeah, I was there for 4 years.
Oh, that's crazy. Did you like it?
I loved it. Yeah, I mean, I stayed on for another year there, so yeah, I absolutely
Yeah.
loved it. Brilliant city, great university. Yeah, really good.
We always
Yeah.
threatened to go and visit, Julie.
Yeah, you never did.
It's too far away for us, to be honest.
Oh.
So why did you choose to go into dentistry?
So I've always enjoyed sort of working with people. I've been in a number of sort of customer facing jobs, throughout school. So I always knew that I wanted to go into something that involved heavily interacting with people, if that makes sense. I know a lot of dental students have family who are in dentistry, but my family is possibly the furthest you can get from that. We have a lot of accountants, but no members in healthcare professions, which I think is quite different here anyway. But when I was in about, I think, year 9 or something in school, I remember being taken to a careers fair where we had loads of speakers come and speak to us from different jobs. And the one that stood out to me most was the dentist who spoke to us, because they explained that it involved working with patients as well as being able to sort of show that creative side that you need to have as a dentist, which I quite liked. So I liked the idea of that. And then I had a little bit more of a look into it and I contacted my local university at the time. So I'm actually from Wales. So I contacted Cardiff University to see if I could do any work experience with them.
Mm-hmm.
And I ended up doing some work experience with them at the dental school. And I was able to see sort of all of the departments they have. So like A&E, the orthodontic side and stuff like that. And that was really, really great. And I think being able to get that hands-on experience at such a young age, I think was what really opened my eyes to the world of dentistry. And I kind of found it interesting. So I thought, I'd stick with it.
It's funny you mentioned the creative side as well. We had Dr. Shiraz Khan on a while ago, and he was chatting about that actually. And I really didn't think of that as being part of dentistry, really, but that is actually quite a large part of the job, isn't it?
100%. I mean, you need to have an extreme amount of manual dexterity because when you think about it, you're working with such a tiny canvas, but you can be removing half of a tooth surface and you need to rebuild it to exactly what it looked like before. So you really need to be able to sort of see and have that creativity, I think, to be a good dentist. So yeah, having that manual dexterity is definitely important.
And that's one of the things as well. It's such a powerful thing, the mouth and the smile, and it gives people so much confidence. It's such a unique part of the body that has both this this surgical side, medical side, but also it has that aesthetics of you need to make it look nice in your work as well.
Yeah, I mean, it's one of those things that you don't really think about until you see how it can impact someone. So I remember seeing a patient who had no front teeth and, then they then got a partial denture fitted by one of the older students. And the change that had on just their everyday life and their confidence is crazy when you don't even think about it. Like you don't think about, having teeth, but when you think about it, a smile is a huge part of a person's appearance, really.
Yeah.
So it sounds like you had quite an early epiphany, if you like, that, you wanted to go into dentistry year 9. So you're just sort of talking about what options you're going to take. Did you cater your education into getting into dental school?
I definitely did. I think in year 10, you're doing your GCSEs. I did, but I also made sure that it was subjects that I wanted to study. So I also studied like drama at GCSE, which obviously isn't a typical GCSE of someone who wants to be a dental student, But I also did things like I made sure I did the sciences, obviously, like all of them, and made sure like I did as many maths qualifications as I could. But I also made sure that I did things that I enjoyed as well. So I did like history and drama, which I think actually is definitely not necessarily a disadvantage because I studied history, but I remember in my interview at Plymouth, because obviously they've changed the interview style now, but when I had a panel interview, I remember them saying like, it's interesting you have history because it's different. you know, it's not what we necessarily expect, but actually it's interesting. So I did cater my like GCSEs and A levels especially, towards getting into dental school, but I also made sure that I was studying things I wanted to study as well.
So that's interesting. How was that process for you getting, you know, the interview process into getting into dental school? Was there anything you did to stand out, or any recommendations you would give for people going through that process?
Yeah, I mean, I applied quite a few years ago now, so I'm sure things have changed. But I think there's just some things that if you are looking into dentistry that you just need to know that you have, and you need to be able to talk about them. So for example, you need to show how you have manual dexterity. You know, they're not going to let you in if you haven't shown that you have at least some sort of creative side to you where you can use your hands very well. So I remember, I think I did like an origami course or something.
Oh wow.
Yeah, so I think a lot of people, you know, they play instruments and things like that. As long as you show the dental school that you can use your hands and that you are very manually dexterous, I think that's probably one of the biggest things to show in an interview, because that's one of the biggest things you need as a dental professional. I also think, you know, not being sort of robotic in your personal statement is important as well, making sure that your personal statement is personal to you and not just sort of itemized list as to why you'd make a good dentist. Because I think that can get quite boring, especially for people who are reading the personal statements. So I think that's quite important too.
And so then you got into dental school, and then what's been your experience so far there?
Yeah, so obviously my experience has been, I had kind of two different experiences because of obviously the coronavirus. But I think as a whole, Plymouth has dealt quite well with the coronavirus. Like, we've been seeing patients since November, which is really, really good for the dental schools. But I think because I actually took a year out before I came to uni, I got my offer and then I decided to take a year out before I came, which is that's not very common, where you find people who take gap years, like, just because I just wanted to take a break before I went into dental school, which I think was definitely one of the best decisions I've made, because dental school is very, very full on, and I think that is important to know as well, because, you know, being a student as it is increases your risk of burnout. So making sure that you sort of can have that work-life balance but also have a break before dental school is important. I think my experience has been great. I like the way that they do exams and things like that at Plymouth, because we have termly exams, which I know a lot of dental schools have all of their exams like at the end of the year. Okay. But I prefer having them spread out sort of over the terms.
Yeah, that Christmas term and then the summer term.
Yeah, because it puts a little bit less pressure on you to do well in every single one. Whereas, like, obviously, if they're all at the end of the year, you have to really sort of remember all of the information that you've been taught throughout the whole year. So I quite like that. And yeah, no, I think student life is great at Plymouth, because obviously it's a lovely city. It's small, but it's not too small. And I think, you know, the people at Plymouth are really nice, and you get to see patients really early on, which is really nice.
I was going to say, how does that work? So you know, what are you doing in year one?
So I think we might be one of the only dental schools who actually lets first year see patients, but depending on which patients you get, you can end up doing things like restorations in year one.
Is that quite complicated, or?
It's not too complicated, and I also think the earlier you start doing it, the better you'll get quite fast as well. So it's not too complicated. I think it is very daunting, because I remember when I had my first patient, I was so nervous. Like, I was just so nervous. But actually, I think it's one of those things that you get thrown into the deep end, but once you get into the deep end, you realize actually it's not that deep, so it's actually fine. So it's quite nice actually being able to see patients from such a young year.
And how much of, obviously, by the sounds of it, you're actually quite hands-on even in the first year. How much of it is that hands-on breakdown between getting involved and also the theoretical side, you know, sitting in a lecture hall, listening to people lecture?
Yeah.
Yes.
So in first year, you only have 1 day of clinic a week, and that starts in March. So before then, you're just doing like practical skill sessions and having lectures, but then you start seeing patients once a week in year one. And that sort of then shifts tests. So then in year 2, you see them twice a week. And then in year 3, I think we're going to be seeing them 3 times a week, 1 week, and then 2 times another week. Wow. So it sort of gradually increases, and you have most of your lectures in year 1, and then you'll have lectures in year 2, and then less in year 3, because by that point you will have sort of been given all of the information or most of the information that you'll need to know. So it's just a case of sort of building on the knowledge that we get in year 1. But I think it's actually quite nice to have the sort of differentiation between having like a practical hands-on session and then having lectures, because I know obviously a lot of other courses, you don't have that. So I think it's quite nice because it means you're doing different things constantly, which I think is quite interesting, and it sort of keeps students engaged, which is really great.
How does the information you get broken down into like subjects? Do you have different things that you specifically have to work on?
Yeah, so we focus mainly on things like anatomy and sort of, histology and things like that in like year 1. And then we see a sort of shift in between that and then going into more clinical knowledge, which we get in year 2. So there's a really big shift between sort of your scientific knowledge and your scientific foundation, and then you move on to sort of clinical knowledge and things you need to know as a practitioner. So that shift sort of happens between year 1 and 2. But we don't get a sort of specification that you get with like A levels and things like that. But you just get a lot of different topics, and that can seem a bit daunting, but they do teach you sort of how to manage that, because you need to sort of make sure that you're keeping on top of that and sort of make your own specification, if that makes sense.
I think it's quite interesting having you on, because obviously you're right in the midst really of doing your your dental school. So have you started to think about how you're going to sort of look for employment once you finish your final year next year? Have you've got a good Instagram account already, which is kind of what we always talk about, funnily enough, on the podcast, and we always suggest to people is to build an online presence now, not just have a CV or a covering letter, actually have something people can go and look at and see you've built a following and whatnot. But are you doing anything else to help improve your chances of employment?
Yeah, I think, especially, to be honest, the world of dentistry is a very competitive world. Like any profession, it is very competitive. So I think you do need to be sort of looking at opportunities that you can get for yourself to make you stand out. So I have a few years left of being a student, which is quite nice. But I have started to sort of look at other things that I can do to sort of, I don't know, not necessarily stand out, but just sort of make a name for myself. So I kind of started with the social media. I decided to make an Instagram just so I could sort of network with other dental students and sort of document my journey. But in making that, I think it was really helpful to me, because I was able to see what other students were doing, and then I was able to ask them how they got involved with that, like opportunities like that. And I think I've become involved with like my local DentSoc. So every dental school has like a dental society. So I'm the president of that this year.
Wow.
And sort of getting involved with things like that. So like I'm the course rep for my year currently, which is great because it means we can like sort of feedback any like positive and negative feedback we have to our staff, which is great. And just doing little things like that, I think helps, because you can just put them on your CV. And I also recently was able to be published in a magazine, which was absolutely amazing. But I wouldn't have gotten things like that if I didn't sort of make that social media account, which I pretty much just use to sort of talk to other dental students about opportunities and things like that, and figure out like how I can get involved with those opportunities.
I love that. It's such a good example of what we always talk about. You have to go above the extra mile. You can't just go and get a degree anymore. You have to put yourself out there.
Absolutely.
So how long is dental school?
So it's 5 years to become a general dentist.
Wow.
Yeah. It's quite a long time.
Yeah. Well, Julie, you managed to stay for 4 years at Plymouth, and you're a mechanical engineer, mate.
Yeah. Wow. I mean, I miss Plymouth. I absolutely fell in love with it. It was a brilliant city to live in and study. And to be honest, the more I'm talking to you, I just want to go back and have a pint on the Barbican or something.
Oh, it's so nice. Yeah, no, absolutely. It's such a lovely city. It's nice because I feel like it's a city, but also you can drive like 20 minutes and be at the beach.
Yeah, exactly. Well, you can walk to the beach.
Well, exactly.
Well, yeah, to walk to the beach, get a boat over.
Yeah,
well,
absolutely.
Enough reminiscing, Jules.
I know.
Anyway, so what's the kind of split between going into the NHS kind of side of dentistry versus private practice? You know, do you have to do some NHS work once you qualify, or is that included in your degree?
So you go, after you graduate, you do what's called like a foundation year. So I'm pretty sure all dental students do the foundation year. So you do the foundation year, which is going to be working in the NHS, and then from there you can decide what you want to do. So it depends on obviously the dental student. Some students just want to go straight into private, but some students want to work in the NHS for their whole life. So it completely depends on the dental student, really. It's just, yeah, it's completely different. Yeah.
And how much of your education, once you finish your time at dentist school,
dental school,
yeah, dental school, thank you. I'm having a mare. How much of it afterwards is continued professional development? Have you already sort of started to think about that? Because I guess with medicine things change regularly.
Yeah, so I think CPD is something you have to do throughout your life, really. It's a requirement. So you just have to do a certain number of hours per year, and make sure that some of them are certifiable. So, you know, CPD is just another thing that you need to make sure that you're doing throughout your time as a dentist, to make sure that you are, which is very important, because you do need to make sure that you are continuing professional development, because it is very, very important. So, you know, it is quite there are quite a lot of hours that you have to do with CPD, but I think it's very, very, very important.
And what sort of personality traits do you see in yourself and some of the other students around you think really help within this industry, helping you study and will help you in the future?
Yeah, so I think the biggest personality traits that I see in, you know, my peers, and I think in most dental students, is empathy. Being able to empathize with someone is a crucial skill if you're going to become a dentist, and that is normally something they ask about in interviews because it's so important. You really need to be able to relate to your patients on a personal level, just to make sure that you can have that, you know, patient dentist rapport. And I think that's something that you learn throughout dental school quite quickly, which is another advantage of sort of seeing patients early on, is that you can work on building that rapport with your patients, which is really nice. And I think another thing would be team working skills as well. So in dental school, or at Plymouth, definitely, we nurse for each other. So obviously as a dentist, you have a dental nurse. At dental school, you will have a dental student who nurses for you, and then you will nurse for them in return. Being able to work with another dental student shows you just how important that teamwork is. And yeah, it's just a crucial skill, being able to work and communicate effectively with others as well. And I think it's really great that you can do that with another dental student, because it teaches you both like invaluable skills.
And at what point during your degree and your learning do you start to think about specialization within different fields in dentistry?
I think it completely depends on the student, because some people come into dental school and they're like, yeah, I'm going to be an orthodontist, whereas some are like, I don't want to specialize. I think it completely depends. I think we get told about it, you know, on and off by our lecturers and things like that, but they don't talk to you about it seriously really until the end of your degree, because I think before you can specialize, you need to become the best general dentist that you can become. And if you're thinking about specializing, you like immediately, then you're going to sort of put the basic general dental skills to the side, which is obviously detrimental. So I think more towards the later aspects of your degree, but some students know off the bat they want to be a certain specialization. Yeah.
See, this might be a bit of an unfair question for you, but in your eyes, what are some of the biggest positives of the industry?
Oh, that's a very good question. I think there are so many positives to the dental industry, to be honest. The first being, you know, being able to help someone to smile again is just an amazing positive that you really can't replace with anything. I think a smile is something you don't think about, as I said earlier, until obviously you're missing it. So by being able to help people smile again, you know, you are helping them in a tremendous way that you can't even explain. I think as well, a lot of people a lot of people view the dentist as a place where they can come and it's a safe space and they can sort of talk to the dentist, and a lot of people have great relationships with the dentist. And I think, you know, being able to work in an environment where everyone's happy and you're able to communicate well with patients is just such an amazing thing that, again, you just can't explain.
Would you recommend other people to go into the practice, study at university? Would you recommend people to study for both the academic side and also the social side? What's sort of been your experience of that so far?
Yeah, 100%. I think if you're interested in it, I think dentistry, much like other degrees, is something you can't just go into if you're not sure if you want to be a dentist. I think if you're going to commit to the degree, you need to know that you want to be a dentist before you can go into the degree. And I think it's definitely not easy at any university. You know, becoming a dentist is not an easy path to choose. But if you want to do it, then it's definitely worth doing. I think in terms of the social side, actually, being a dental student at Plymouth is great anyway, because you can get involved with your local DentSoc and things like that. So you'll always have events where you can meet other dental students and things like that. And especially in terms of, I know a lot of dental students will say, oh, well, you will have no time to socialise, but that isn't true. You can make time to socialise as long as you work with your time effectively and make sure you're revising effectively. You really can have time socials, especially in first year. I think it's actually not that hard to balance. You just need to be smart with how you plan your time.
So somebody listening to this thinking, you know, I'm going to go down the route of being a dentist, what are the top 4 things they can do to help them, you know, progress to getting into dentist school?
Well, that's a very good question again. I think the first thing I would say is experience. Get as much experience as you can get. And I know obviously that's hard in the current pandemic, but I think getting as much experience as you can will really, really help you, and it'll consolidate your decision to become a dentist as well, because you need to make sure that you want to do this for the next, rest of life, the next 20 years or something at least. So I think getting as much experience in as many different fields as you can as well. So, don't just go into your general dentist and get experience there. Contact your local hospital or contact your local university and ask if you can do experience with them, especially work hard. Anyway, I was really lucky to get experience there because, I was able to go into A&E, I was able to go into sort of the emergency side of dentistry as well as the orthodontic side and the pediatric side and all sorts. So I think seeing lots of different dental professionals at work is really important, and not just going to one dental practice to get work experience. I definitely get as much as you can. I think the second thing I would say is make sure that you, how do I say this? Make sure that you know how to manage your time effectively before you get to uni. Really use your A-levels as a chance to know how you revise, but also make sure that you can control your work-life balance and still have that during A-levels, because that's something that a lot of people forget at university, but it's something that's really important in keeping your mental health good and healthy.
I think Julie might have forgotten how to balance his time between that and the pub, to be honest.
Mine went the other way though.
Well, I mean, now lockdown's over. So. And then also I would say do things that aren't dentistry, to be honest. I think a lot of dental students just do dentistry, which is good, but for me that definitely wouldn't work. Have hobbies that aren't to do with dentistry or teeth. Join your local water sports society or something, or if you have any clubs at school, find a hobby that's not to do with dentistry. And then
sorry, have you built any expectations salary wise for once you leave university? Does anyone ever talk to you about that? Because we often ask all our guests that are in the industries, these are some figures, these are the averages, do you agree with them? And when we looked up dentistry, the average starting was around 32,000. I just wondered if anyone had ever talked to you about that, or that you'd thought about salary.
Well, I know we get lectures about it later on. We haven't had any yet because we're just so early on in our degree, but we have been talked to by external companies. So I know through DentSoc we organised a talk with Wesleyan, who did talk to us about finances and stuff. I haven't built too many expectations up because, as I said, because I haven't got family in the sort of dental field. Obviously, when I came into it, I didn't really have any expectations as to what my salary would be. But I know that, you know, the starting is 32. That's from your foundation year. So and then obviously it'll gradually increase. But personally, I haven't. I know, again, some people will. And if people have family who are in dentistry, then obviously they'll know. But we get told about that like a little bit later on in like year 4.
That's fair enough. Is there anything that you never expected to be doing, being involved with along this path into becoming a dentist, and it's more of a regular occurrence than you expected?
Yeah, 100%. I think the biggest thing that has changed, or the biggest thing that I've discovered in dental school, is actually how confident you become. You know, you have to do so many things on your own as a dental student. You know, we have to deliver like these things called student-led plenaries, which are like a lecture. It's a small lecture basically that you have to deliver in front of your whole year group. But even just doing little things like that really helps you to build your confidence. And I think learn how to speak in front of like big audiences, which is something that I actually never thought I'd do, because when I was in A-levels and GCSEs, I was so shy. So I think that, and I've talked to a lot of my friends as well, and they feel the same, where they just didn't think that they'd be able to, you know, just go into a room and talk to a bunch of strangers. But actually, dental school has taught us that it's actually so much easier than we think, which is really, really great.
Awesome. And would you still do this degree, knowing everything you know now?
Yes, definitely. I think I remember when I first did my work experience with students, they were all saying don't do it, it's so hard, like you'll never have any time and anything like that. So I remember going into it, I was like, oh my gosh, what have I gotten myself into? I got so scared because I've been terrified by all these older students. But I think honestly, it's not as daunting as people make it sound. You just need to know yourself and how you work effectively and just not waste time. But also, you know, if you've been revising for like 6 hours straight, just stop revising. It's not going to go in, you know, just relax. So I think that's I definitely do it again. Yeah.
Well, thank you so much for taking the time to come on, Maisie. It's been really interesting to hear your perspective and point of view on the degree.
No, thanks for having me. Thank you so much.
Thank you. Where can people find you on social media and ask you any questions and stuff like that? Reach out.
Yeah, so if anyone has any questions, feel free to message me on Instagram. My Instagram name is @Maisie's Dental Diary. So yeah, feel free to drop me a message with any questions you have.
Awesome. Thank you so much.
Thanks again, Maisie.
Thank you so much.